Buchanan County Health Center would like to welcome you and thank you for choosing us to provide surgical treatment for you. BCHC provides ambulatory surgery options, which means you will go home the same day of surgery. As our patient, we want you to receive thorough instructions and include detailed information to make you feel more comfortable about your upcoming procedure, as well as improve your overall satisfaction while at BCHC. 1 week before your scheduled surgery, one of our surgical team members will call you to review the preoperative instructions with you and answer any questions you may have regarding your surgery. Patients are discouraged to bring valuables to the ambulatory surgical unit, but some items should be brought to BCHC for a smoother stay. During the preoperative telephone call, the nurse may remind you to shower and wash your hair the morning of surgery and wear comfortable, loose-fitting clothing, along with no cosmetics, no nail polish or fragrances, and to bring the following items: insurance card and photo identification or driver's license, list of medications you currently take, list of all allergies, and eyeglasses or dentures if applicable. Please arrange for a responsible adult driver and an adult who can remain with you 24 hours after surgery. It is imperative to follow the diet instructions given to you during the preoperative instructional telephone call. Do not eat or drink after midnight before your surgery unless your surgeon told you differently. Please do not smoke, use chewing tobacco, chewing gum, or use breath mints. The nurse will instruct you on the usage of your current medications and the medications you may need to take prior to surgery. When arriving to Buchanan County Health Center, please be aware of construction zones as we are currently undergoing a large expansion project, instilling our commitment to providing high-quality health care for you and your family. Because of this expansion, we would like you to park in the emergency and registration parking lot located on the northeast side of our campus as shown on the map. Welcome to Buchanan County Health Center. Upon arrival and entry through the emergency room entrance, you will be welcomed by our registration team. Our registration team will be expecting you the day of your surgery. This is where you will provide them with information regarding your insurance card and photo identification or driver's license. You will sign a consent which allows BCHC to provide surgical care for you. You will be asked to state your name and date of birth, and the registration team member will place a name band on your wrist. Throughout your stay, the surgical team members will check your identification bracelet and ask you to provide your name and date of birth to continually strive to provide safe patient care and to protect your privacy. After you have checked in, the registration team member will then escort you down the hallway to our waiting room area. The patient waiting room is where you will wait for the ambulatory surgery nurse to escort you to your room to prepare for surgery. The nurse will assist you in becoming familiar with your surroundings to help you feel comfortable throughout your stay with us. When entering your room, our ambulatory surgery nurse will give you direction as to where to place your belongings and instruct you to change into the surgical gown that will be provided for you. After you have changed into your surgical attire, the nurse will review your identification bracelet once again and ask you to provide your name and date of birth. The nurse will then check your blood pressure, pulse, and oxygenation along with other assessments to ensure you are ready for surgery. She will ask you about your health information regarding your allergies, medication lists, and when you last had anything to eat or drink. She will then discuss information about your surgery. You will then be asked to sign your surgical consent at this time if this has not already been signed. An IV line will then be placed into a vein in your arm or wrist. It is used for supplying your body with fluids and medications during surgery. You may also be given medication to help you relax along with other medications that your doctor has ordered, such as antibiotics to reduce the risk of infection. The operating surgeon may stop in to see you throughout this time as well. If your surgery is to be done on one side of your body, the site may be marked with a special pin by your surgeon. If you need the services of our anesthetist, he or she will visit you at this time to discuss your plan of care. A nurse from the surgical team will arrive to transport you to the operating room. The nurse will also verify your name, date of birth, surgeon, and the surgery you are to have done. She may also ask you similar questions that the ambulatory nurse has asked. This patient verification is part of our hospital policy to ensure you are aware of the nature of your surgery and to provide a safe transition of care and privacy. The operating room is considered a sterile environment. All surgical team members will wear protective clothing called scrubs and caps. They may also wear masks, eye shields, and gloves to prevent the spread of germs. The operating room is brightly lit and the temperature is very cool. Operating rooms are air-conditioned to help prevent infection. An operating room has specialized equipment and monitors. After you have been taken into the operating room, you will move to the operating table. The surgery team will place a safety belt and monitors will be attached to various parts of your body to measure your pulse, oxygen level, and blood pressure. While you are being transferred to the OR, the ambulatory surgery nurse will escort your friends or family back to the surgical waiting area. The nurse will inform them of nearby restrooms, vending machines, our auxiliary gift shop, and the cafeteria that they may utilize during your surgery. A television along with reading materials will be made available in the waiting area. Once the surgery is completed, you will be transferred back to your room on a patient cart by the operating room nurse. During this time, a surgical team member will take your family and friends to the consultation room to meet with the surgeon about your visit. When you arrive back to your room, the nurse will continue to assess you and you may be released within hours of your procedure. Before discharge, you must be able to breathe normally, drink, and urinate. You are not allowed to drive immediately following the use of anesthesia, and this is why you will need to arrange transportation home. You may feel groggy until the following day. Before you leave, a nurse or other healthcare provider will go over any instructions on diet, medicine, and personal care information depending on your surgery. You will then be told what things or activities you should avoid and for how long. You will be instructed on who to call if you have a problem. Instructions will be given to you in writing. At this time, the nurse will escort you to the ER entrance for discharge. Following your surgery, you may be chosen by mail to answer a brief survey and share your thoughts about your visit to Buchanan County Health Center. Your input will help us understand what we do well and what we can improve upon. Your information will be greatly appreciated. To ensure confidentiality, this survey is administered by an independent third party, Prescaney Associates. Your participation will help us to improve the quality of care that we provide you, your family, friends, and neighbors. This completes the preoperative instructional video. Should any questions arise after viewing this video, please call us at 319-332-0999 or visit us online at www.bchealth.org. Thank you for taking the time to prepare with us for your upcoming surgery, and thank you for choosing Buchanan County Health Center for your surgical needs.
Here for you, trusted for life.